Good evening, Southside Cardinals. This is Janice Bell, and I'm here to have another session of our family information sessions. Tonight, we're going to be talking about safely returning to school and our phase 2, which begins on Monday. Phase 2 is limited to students who have been called by their campus and invited back to start our face-to-face instruction. These students are mainly students who are in special programs with a few other students involved as well. We have received some questions about phase 2, and I would like to address some of those now. Some parents have received calls even though they understood they had put 100% virtual on their student survey. Please just inform the school if you want to be 100% virtual when they call that that's your desire. Your child will not be counted absent, but please inform the school when they call. Some students in phase 2 will be other than pre-K students. Those students will be called as well, and some of phase 2 will involve students with limited access to technology and other special circumstances. Phase 2 may begin before October 13th. By October 13th, our goal is to have all students and their families who desire face-to-face instruction to be enrolled and coming to face-to-face instruction at Southside ISD. There will be paper packets available only for the next couple of weeks. After the October 13th, 100% back face-to-face, there will no longer be paper packets available. And all students participating in virtual instruction will need to participate through technology-assisted methods. Transportation is available, and we will be watching a video now about how to participate in transportation safely. Thank you for sharing that video. That was put together by our awesome communication staff and our transportation team. Next, we would like to share a video talking about all of the safety precautions that have been done at our campuses to make each campus as safe as we can for the beginning of school.
Here at Southside, there's so many opportunities. It's not just the FFA. We have the culinary arts, ROTC, we have an amazing band, amazing athletic coaches. Come to Southside, come see what it's about. Give us a chance to show you that we have what it takes for your kids to become someone in the future.
Thank you for that great video about our school district. If you have questions and you would like to have them answered, please feel free to put them in the comments on our Facebook Live. Our special guest is Dr. Wu from the San Antonio Metro Health, and she will be logging on shortly. While we wait for her, we're going to talk about a few other things that have occurred in our school district. We have developed a plan for all students to enter our video about our school district. To enter our campuses as safely as possible. We have met with each school. Mr. Ramirez, our superintendent, has met with each school and gone over their safety plans, beginning from parent drop-off and bus drop-off with temperature checks, all the way through meal service in the classrooms at most of our campuses, the individual teachers' classrooms. We will have teachers who are teaching face-to-face and teachers who are teaching virtually. Our goal is for no teacher to have to teach both. So we want to make it as safe as possible for our teachers and for our students. Dr. Wu has worked with our Deputy Superintendent, Dr. Fred Hayes, on various issues concerning our Safe to School plan. And she was planning to join us. Unfortunately, she was held up in traffic, and we are waiting for her just a few minutes. Hello, Dr. Wu, and welcome to our Southside ISD Family Information Session. We're glad you got to join us. Let me introduce Dr. Wu. She is our medical director for the San Antonio Metro Health, and she has served in that position since 2015. We're glad you're here to talk to us about current community and school health conditions and to talk to us about best safety practices.
Thank you so much. I apologize for being late. I understand you got to watch some good videos. The practices you all know. I mean, I can boil them down to people, space, and time. The fewer people you're around at any time, that 6-foot distancing for space, minimizing the time if you can't be minimizing those other things, those are all protective measures. And it's layers. No one of them is enough by itself. As far as where we are, we get a lot of questions about why the community-wide indicator is green and the school indicator is still in the yellow zone. And the one thing that is hanging up that school indicator, because it is, it's designed a little differently, obviously, is the positivity rate. And you're probably aware that nationally, all the ones that I've seen other than New York are using 5% as part of their index. New York is using 3%, but it's a commonly used standard. And so we're making great progress going down every week, and we're very close. But really, I wanted to not spend a bunch of time talking and spend most of the time listening and answering your questions, you who are on the front lines and trying to do the implementation. So please, how can I help you?
Well, Dr. Wu, I'm going to throw open to a few of our employees that are on the call with us to ask a few questions. My first question would be, can you tell us the importance of wearing masks? We in our school district are requiring all of our students to wear masks to school and face shields. Our face shields look something like this, and we're providing them for all of our students. So can you talk to us about why those steps are important?
Yeah, so masks, there is more evidence about the totality of using all of these, what we call non-pharmaceutical interventions, like distancing, like hand washing, like masks, all as a package, than about individual measures. But when you look at masks, one of the most persuasive studies that I have for fabric masks is one that the CDC had published earlier this year, where there were two people who worked in a hair salon and worked while sick. They did the thing you're not supposed to do. They worked for 8 days while sick. These were hairstylists, and they wore masks that were at least 2 layers. So fabric masks, the World Health Organization recommends, if you're going to be super picky about it, they have a whole video that explains like the kinds of fabric and everything, but they do recommend a 3-layer mask with fabric on the inside and outside, and then something called polypropylene in the middle. The CDC just says at least 2 layers. So you want a cloth mask that's at least 2 layers. You want to not touch the front of it when you put it on and off. You want to cover the nose and mouth rather than wearing it as a chin strap. And those 2 hairstylists, they had fabric masks. Their customers had fabric masks, and there were no infections among almost like 200 people, I believe. It's been a little bit since I read that study. One of them did infect the other one, which is why we have 2 people, because they spent time around each other unmasked. So one person was able to infect the other. Now, I was a mask skeptic for a fabric mask. I'm sorry, not about medical masks. I work in medicine, but I was a fabric mask skeptic for a long time. But that one really did help persuade me. From a prevention standpoint, the idea is that if everybody wears a mask, then, because some people can have COVID and not know it yet, right? And you're highly infectious, especially that day before your symptoms are about to start and the day right before. You could pass on the infection to somebody else without even knowing you're infectious. So if everybody wears a mask regardless, then we're going to reduce the risk. And so we have lots of anecdotal evidence for that. If you look at the San Antonio curve and sort of look at when mandatory masking started, you can see a difference starting about 2 weeks after that. So there are little other pieces of evidence like that. Face shields. Eye protection is something that the CDC recommends in a medical setting for anyone working in a community where we're in the mild to moderate, for moderate to substantial community transmission. Now, there's not one definition of moderate to substantial that everybody uses. There are something called Harvard Global Health Metrics, which if you use those numbers, then we are, I would say mild to moderate right now, community-wide. So eye protection is because it's not the most common way of transmitting COVID, but we do see a small amount of COVID transmission through the eyes. And I want to say we're still learning a lot. Ask me next year and we'll be able to tell you even more about that. But just anecdotally, we've seen a few instances of transmission through the eyes. So eye protection in just the everyday non-medical world, I think it's out of an abundance of caution. There's not a CDC recommendation that people need to do that. And I say don't let a face shield be a substitute for a mask, because you can imagine that respiratory particles can go in around the sides. So the CDC definitely says a face shield is not a substitute. If you're going to wear it, it should come down past your chin and wrap around your face. I recognize that sometimes with the littles, those 4 or 5 6-year-olds, they really need to see lips and facial expressions as part of their learning, right? As part of that whole social emotional learning context. So, I don't have it's medium risk. I don't have a great answer for that. I understand what you've got to do as educators, and as long as everybody understands that that's a little bit higher risk, then and people understand the risk benefit and they want to take that risk, then there are absolute benefits to being in in-person learning, especially in that age group. Yeah. Thanks for the show and tell. Yeah. Are you talking? You're muted. You're muted.
Oh, I'm so sorry. I was a kindergarten teacher at one time, so, show and tell was part of my world. I have another question from one of our people out on Facebook Live. It says, I'm scared to get the flu shot. Is it a good idea?
The flu shot is not a live vaccine. It's normal to be scared of things that we hear bad things about, right? And the CDC actually has a page. If I can find it, I'll send it to Ms. Bell. If I can, I can find it and I'll send that link to Ms. Bell. I'll make a note to myself that's got a lot of these questions that we frequently get, like, well, it's, I know somebody, or I got a flu shot and then I still felt sick. I don't want to spend a bunch of time in this call about it, but there are actual answers to all of those questions. Another one is like, I hear it's not that effective. It is not, it's about 50-50 for preventing some sort of flu-like illness, but it is about 90% effective for making sure you don't end up in the ICU with your flu-like illness. So if you do catch the flu, it's going to be much more manageable. And if it's really the flu, by the way, a lot of times people have some respiratory conditions because it's not magic. It doesn't protect you from every respiratory infection, right? But it does protect you from the flu. The other conditions tend to not be the kind of thing that knocks you off your feet for a couple of weeks, like the flu. Yes, I understand why you feel afraid. It's not a live virus, and I'll send Ms. Bell the CDC Q&A. And if I could briefly talk about the COVID vaccine, because I would love to start having that dialogue with the public. I can tell you, we're gonna keep on coming out and telling you what we know and what we don't know, because I think there's a whole swirl of misinformation, lack of information, fears, and it's true, we don't have all the answers right now. But what we know is we're going to know more about safety than effectiveness, probably when it first comes out. Certainly we won't know about long-term effectiveness because they won't have had a very long time to do the studies. I think it's a really individual decision for every person. But I would love to also take away some of the fears. The people who I either know or know of who are working on regulation or on the vaccine trials, everybody is taking all measures to make sure that this will be safe. Like I said, I'm not as worried about safety. If anything, the very first vaccines, the mRNA ones, it's not a matter of whether they're going to stay in your body and do things that you don't want it to do. It's more a question of, is it going to stay in your body long enough to do anything? Because these are the mRNA proteins can be degraded pretty easily. So I think, again, there's going to be a lot more information about safety than about effectiveness. So it's going to be up to you to decide, well, Am I willing to take a chance that it doesn't work? But on the other hand, if it works, I'll be protected and I'll be able to feel more confident doing more versus, well, I'd rather wait until about 100,000 people have tried it, and meanwhile, I'll take my chances. Everybody has to make their own decision about that. What we do know is it's probably going to not be on the market in any reasonable quantities until the spring. There may not be very much, certainly in the fall and even in the beginning of the spring. The supply chain, this is something that's a logistical challenge for us. Some of these have to be kept at minus 70 degrees. Some of them can only keep for 5 to 7 days. So that's what we know. We don't know which brands are going to get FDA approval. Nothing that does not have emergency use authorization will be used, of course, by public health. We don't know when, we don't know what volumes we'll have, and we don't know effectiveness. Next question.
I'm looking as people are sending them to me. I do have a question from our lead nurse, and she would like for you to explain the difference between isolation and quarantine.
Oh, I love that question. Thank you, because people do use those words interchangeably. So quarantine, even though it sounds really scary, is for people who are well. They've been exposed, but they don't have any signs of sickness, and we're watching them to see if they become sick. Isolation is for somebody who is sick. And actually, both of those words can be scary. So I've noticed that some schools are using some different words so that the children don't feel stigmatized, and I support that.
Okay, thank you. Another question that has come up is, when should I keep my child at home?
If your child has any of those COVID symptoms, which can be, cough, trouble breathing, sore throat. In children, we more often see the stomach issues like nausea, diarrhea, throwing up. Sudden loss of taste or smell is very distinctive for COVID. Fever, which we define as 100.4 or above medically. But when we're trying to screen people out of a workplace or for coming to school, we don't wait for somebody to have a full-on fever, right? So for most screening questionnaires, if you get to even 100, then don't go in. Now, we're about to enter allergy season, right? And what we ask this year is just be extra careful and don't say, well, it's probably allergies. And please keep everybody at home. So everybody stay home. So if it's you're the parent asking, or if it's a child, keep your child at home, even if it might just be allergies, because this is not a normal year.
Okay, thank you. And we've had a question also, do you need a test to come back to school? So a test that says you're negative, or do you come back when symptoms are gone? What would be the recommendation if you've tested positive and we know that you have COVID before returning to school? I will tell you that we have our employees who have had that experience. We do require a test, but we would like to have your opinion as well.
Well, we're going to go with the CDC recommendation, which is not to require a test for somebody who's been positive before most of the time. I mean, the rare cases where somebody has a severe immunosuppressive condition where a test might make sense and where they might stay out even longer than the normal amount of time, even without a test, that's rare, and we can go through those case by case. But for most people, after your positive test, here's when you can come back. If it's been 10 days since you had symptoms, or since your symptoms started, okay? If you didn't have symptoms, then 10 days since that test was done, not the day you got the result, but the day the test was performed. So it's been at least 10 days. And if you have symptoms, they've gotten better. They don't have to completely go away, because we know that sometimes people can have a cough for a while that lingers, or you can still not have that sense of taste or smell back yet. But we think you're definitely past the part where we'd worry about you infecting other people. And then finally, you have to have all three of these. So 10 days, symptoms are better, and you have not had a fever for 24 hours without taking any medicines that would take away your fever. So that doesn't count, right? So you haven't taken Tylenol, you haven't taken aspirin, you just on your own haven't had a fever for 24 hours. If you've done all of those three things, then you can come back without a test. And the tests, the tests can lead you astray. That's why we don't recommend it.
Okay, thank you for that. We have a question about, does the Southside area of San Antonio have a higher COVID rate than other parts of San Antonio?
The Southside has a higher rate, although I think we see our highest on the west side, on the east side, but that really speaks to all the other social determinants of health is the jargony word we use, but it's all those other things that go into your health that don't just have to do with time in a doctor's office, right? So are you able to work from home, or do you have to go in? When you go into work, are you around a lot of people, or are you around just a very few? Or at home, if somebody else in your home gets sick, are they able to stay away from other people and keep everybody else safe? Or is it kind of more crowded and you can't? So all of those things play a role. There are more that I'm not going to bother to list, but we know that that affects our Black and Brown communities more. And so that's a health inequity. By the way, if you can't isolate at home, call 311 and we'll work with you on some alternatives.
Okay, thank you very much. I know that we have a COVID team that's formed here in our school district, and we have received a question to you about campus closures. So what are the things that the district team would need to consider before deciding to close a campus once again?
You would be working in consultation for Metro Health for that part. You'd be talking to our epidemiologists. It would have to be a pretty big outbreak to close the whole campus. We define an outbreak in the school as at least 2 people who got the infection from each other on campus. So there might be a school that has 10 people who have COVID, but this one person got it from their spouse, and this other person got it, at some other, at a restaurant or what, but if there are 2 people who got it from each other on campus, then that counts as an outbreak. And the most common measure that we take is to send that one group of people home. Often it's a classroom, so you send that you flip that classroom to virtual. But sometimes it's a certain set of staffers, and we try to do the least disruptive thing that will still help us contain the infection.
Great, thank you. We have a question from a parent asking, if I have a child who has asthma, should I keep them home?
Oh, the CDC also has a checklist that's on our website at covid19.sanantonio.gov to help you weigh the different things. And it might be something where you talk to your child's pediatrician, because I don't know how bad the asthma is, and your pediatrician would. Among the things, the kinds of medical problems where people get more sick if they do have COVID, some of the ones that are definite yeses are obesity, are diabetes. Some of the ones that are more maybes are asthma. So I hope that's helpful. But the part that Yeah, I can't walk in your shoes. So I don't know. I mean, the two things you're weighing are, what is the risk, which might also include who else you have in your home, who maybe some, elders in your home. And on the other hand, what's the risk for my child's education and learning loss if they're not getting to go to school? For example, there are some special needs kids who just really aren't able to get anything from the online learning, right? So your child, you also know how well your child's going to do at following rules like wearing a mask and staying away from other people. So those are some of the things that you'll see in the checklist.
Okay, great. Thank you so much. Well, I don't have another question here in front of me. I'll throw it out to our folks that are on the call with me. If anybody would like to have a follow-up question.
Hello, Dr. Wu. This is Randy Escamilla. It's good to see you. One of our parents is asking a question that if my child has flu-like symptoms, and you've touched on this, but again, it keeps recurring, coming up in the chat box. If my child has flu-like symptoms, should I keep him home? What should I do?
You should keep your child home. You should get the child tested. If you're not able to through just a regular doctor's visit, then again, go to covid19.sanantonio.gov to look for the places that we offer testing in the community. And if the test is negative, so it's not COVID and they already had symptoms, right? So if by the time somebody already has symptoms, we hope that the test is pretty accurate. And in that case, you would keep the child home until whatever the district rules say as far as children who have flu-like symptoms, right? And so it's usually going to include that they haven't had a fever for 24 hours and that the symptoms are better. If your child is positive, then you follow those other rules that I was talking about, the 10 days and the symptoms are better and they haven't had a fever for 24 hours. And meanwhile, as much as possible, when you're taking care of somebody who's sick at home, and of course, this is going to depend on how old your child is, right? You can't really isolate a child when they're sick, when they're so dependent on you. But that if it's an older child and you can do that, then ideally they're staying in their room and you're dropping off food and whatever else they need at the door. And after they use the bathroom, you're thoroughly cleaning it. If it's a smaller child, then maybe you and your child are isolating together away from your other household members. And if you don't have the luxury of doing that and everybody's all mixing, then we recommend that everybody stay home. And here's a tricky and frustrating part. If for somebody who doesn't have symptoms, who lives in your same house, and you have a child who has COVID, they're 14. So if you're exposed to COVID, you're supposed to quarantine for 14 days and just see if you develop symptoms, right? If you, so that means that your calendar starts after that child's better. So when that child finishes their 10 days, after that, on day 11, that would be my first day if I live in that household and I have not been able to separate myself from that child. So I should stay home for 14 days after the child's better. Okay. So again, if you're not able to separate, call 311 and we'll talk you through some of the ways that we might be able to help you separate.
Well, thank you. I do have a question that I'll take. There was a question about, will students remain with their current teacher if they're currently virtual and they do come to school? We will do everything at the campus level to keep the students with their current teacher. However, we will have some teachers who teach 100% virtually, and we will have other teachers who teach 100% face-to-face. And that may mean that some students are changed to a different section. You will stay with the same campus, you will stay with the same grade level or course that your students are enrolled in, but there is a chance that you will have a different teacher. We'll do everything we can, but there is a chance your child will have a different teacher. That was one of our questions. I do have another question for you, Dr. Wu. Could you go over with us the importance of hand washing and kind of some safe steps for being consistent on hand washing that we maybe were able to work with our students before we start back to school, especially?
So I've heard of some schools that are actually just scheduling hand washing every hour or every, however much. So what you want to avoid is touching surfaces where somebody else who has COVID might have, I don't know, blown their nose and then touched a doorknob. I hope not, right? But you want to avoid touching a surface that somebody else might have left COVID on and then touching your face. Because COVID can get in, as we said, maybe through your eye. Well, rarely, yes, through your eyes, but also, your nose, your mouth. So one of the ways to avoid doing that is to just not touch your face. Studies show that on average, we touch our faces 20 times an hour without even thinking about it. I was going to go off on a tangent, but I won't. So that's like more than 400 times a day. So the other thing we can do is clean our hands a lot to decrease the chances that we're touching our face with unwashed hands. And ideally, you're cleaning for 20 seconds. You're covering all the surfaces. If you do something, get some suds and do something like this, then you're cleaning under your nails a little bit. Don't forget the backs of your hands. So if you do all that, it'll end up taking 20 seconds.
Okay. Okay, go ahead.
I just have a question. One is on children wearing masks. Can you talk a little bit about that, the correct and proper way for children to wear masks again? And then another question for you that I have is, what are you seeing at Metro Health from in terms of the number of children who have gotten COVID from other school districts?
Yeah, thanks. So the only difference for children and grown-ups as far as the mask recommendation is that it's not recommended if you're younger than 2, or if you have some condition where if you were having trouble breathing, you wouldn't be able to communicate it. Those are people who would rather not put something over their faces. But for everybody who wears a mask, ideally you're cleaning your hands before you put it on. You hold it by the edges and not the middle of it. You cover your nose and your mouth. You leave it alone and don't fiddle with it all day long. If it's got a little wire like mine does, then you bend it around your nose. Then when you take it off, same thing. And then you avoid touching the front of it because that's where the germs are. And try to wash it every day after you use it. Now, if you just use it for 5 minutes, I don't mean that you have to do that. But if you use it for a full day, we recommend washing it at the end of the day, and that also helps you not, reuse it and touch it a bunch of times and possibly still self-contaminate from there. What are we seeing in other districts? Well, we are seeing a few outbreaks already. Again, that's a transmission to people within the school, and it's actually. We've seen the most among staff who are not teachers. So those ancillary staff, maybe in a meeting or maybe at lunch. We run into this all over the city, not just at schools. Your staff who do everything that we ask while on campus or while at work, and then they go out to lunch together and they're 2 feet away from each other and they're not. So lunchtime or just a meeting where people weren't masking. After that, we are seeing about equal, maybe the next one, the last time I counted was in teaching staff, and then the fewest so far in students, but this was a couple of days ago, and the data keep changing every day. There's also a lag, right, between when people go back to school and then if somebody does get sick, having symptoms and then deciding to get tested and then the school finding out. So we're really just now starting to see reports of cases from the beginning of last week or the middle of last week. So keep in mind, there's always that lag.
Okay, thank you so much. I'm going to leave it one more opportunity for any of my colleagues on the call if they would like to ask a question. I thank you so much, Dr. Wu, for your generous gift of your time. I want our community to know that you're going to be doing this again tomorrow in Spanish for our Spanish-speaking families. And we can't tell you how much our community appreciates it. I am going to close. I'll give you an opportunity to close. And then we're going to watch our transportation safety video again at the end as our closing. We had a little technical difficulty at the beginning and there was no sound. And so please feel free to close and then we will end with our transportation safety video.
I would love to stay and watch the transportation safety video too. But you know, I know everybody's tired and it's normal to be anxious and angry and tired of all of this. So I thank you for sticking with it. I think we've done a great job as a community bringing down the rate, and we have to stay with all of these precautions until there's an accessible vaccine. The virus is still circulating. We now know a lot about how to keep it at a controllable level. And we can't just go back and pretend that everything's 2019 because it's not. And that virus can spike really fast, right? That's what we saw in July. So thank you for everything you're doing, and also thank you to. So that's sort of to everybody who's watching and on Facebook, but also for you at the schools and for inviting me here. Thank you for the very hard work that you're doing too.
Okay.
Hello, Southside students.
Thank you so much.
Here are instructions for boarding the bus at your bus stop. When the bus arrives, the bus driver will direct you to sanitize your hands. Once your hands are sanitized, the bus driver will direct you to your seat. The bus will be loaded from the back of the bus to the front, with one student per seat unless you live in the same household. Once you arrive at school, all students will exit the bus one at a time from the front of the bus first to the back. All students will remain seated until the aisle is clear. Also, drivers, give us a break, and when you see a bus, take it slow and watch out for children. Thank you.